Hi, I'm Dr. Stephanie Young Moss, the founder of Menopause in Color. I'm a pharmacist and I'm also a menopause educator and advocate. Today, we are going to discuss the most common symptoms of perimenopause and menopause. Before we get into that, let's discuss the definitions of menopause and perimenopause. Menopause is defined as not having your period for 12 months and 1 day. This is typically when hormones decline, and this marks the end of your reproductive years. Now, perimenopause is the transition period prior to that, which can last approximately 5 to 10 years, depending on the person. This is when your hormone levels are increasing and decreasing, fluctuating throughout the month. A lot of times, the perimenopause stage can actually be the most symptomatic because of those hormone changes. So today, we're going to discuss symptoms that can be seen in perimenopause and menopause, and these are typically the most common ones that we see. Remember, there are tons of signs and symptoms for perimenopause and menopause. While some may have no symptoms, others may experience various symptoms. So let's talk about those 5 most common symptoms that you typically see. Before going into these signs and symptoms, I want to make sure that if you're experiencing any of these, that you talk to your healthcare provider first. It is very important that you are able to manage these symptoms and not suffer from them. So while some can be handled with prescription medications and hormone therapy, which is actually first-line treatment for some of these, but today we're going to actually discuss the natural ways to alleviate some of these signs and symptoms. First up, we have hot flashes. Hot flashes is the most common symptom as seen in perimenopause and menopause. About 80% of women will experience hot flashes. This can be described as an intense heat in the neck, face, and chest area. Now, of course, you can do things like carry a fan and make sure that you dress in layers. But did you know that vitamin E has also been shown to help alleviate hot flashes? Also, foods that are considered phytoestrogens have shown to help alleviate hot flashes. Some foods that are considered phytoestrogens are soy, edamame, and also flaxseed, to just name a few. Next, we have irregular menstrual cycle. Now, during perimenopause and menopause, some people will have a change in their cycle. I don't like to say that it will increase or decrease because it's different for everyone. Some people will have heavier cycles while others will have lighter cycles. Some people's cycles will go from 28 days to 26 days, while others will experience heavier bleeding. So any changes in your cycle could be a sign of perimenopause and menopause. A vitamin that has been shown to help with this symptom is vitamin B6. Vitamin B6 may help regulate hormone levels and support menstrual cycle regularities. Next up, we have mood swings. Now, mood swings sometimes can be one of the first signs that appears in perimenopause. However, many people don't recognize it because we're simply waiting on the hot flash. Now, with mood swings, this could be anything from having a sense of anxiety or depression, going from one mood to the other easily, especially becoming very irritable with small things. I've also seen people who may have been diagnosed with OCD that have gotten a handle on their symptoms. However, sometimes with perimenopause, those OCD symptoms can come back. One vitamin that helps with that is vitamin D. Vitamin D has been shown to help with mood and also a lot of other perimenopause and menopause symptoms. It's important to talk to your healthcare provider to see what level you would need to help you the most. One symptom that I hear about a lot is insomnia. Insomnia is a very common sign and symptom of perimenopause and menopause. Many people will wake through the night and feel extremely tired the next day, which really makes it hard for them to function on their job. Now, with insomnia, some people may be experiencing hot flashes or what's called night sweats as well, and this could also wake them up. Now, one vitamin that helps with insomnia is actually magnesium glycinate. If you check my page, I do have a video on magnesium that talks about the benefits of different types of magnesium. Next up, we have one that a lot of people won't want to talk about, but it's vaginal dryness. Now, once again, this does not happen to everyone. However, vaginal dryness can be caused by a decrease in estrogen. However, there are things that can help with that. One, you can increase the amount of water that you drink, making sure that you're staying hydrated, but using things like hyaluronic acid or other natural oils can also be helpful and alleviate dryness. Let's remember that vaginal dryness can also contribute to other things as well, like painful sex and also infections as well. So it's important to address this and talk to your healthcare provider if you're experiencing this symptom. So those are the 5 most common signs and symptoms of perimenopause and menopause. It is important that you talk to your healthcare provider and be able to discuss any of these signs and symptoms that you could possibly be seeing. Build a community and don't be embarrassed about talking about these signs and symptoms. I hope that you enjoyed the video. I hope that you like, share, and subscribe, and I will be back to talk about other things surrounding perimenopause and menopause.